Good afternoon and welcome to today's edition of Black Health Trust. We're so happy that you chose to spend this time with us, and we are expecting to have a lively discussion as usual. Without further ado, I'll turn it over to our founder, Dr. Randall Maxey.
Thank you, Dr. Neighbor-Stevens. Hello, Dr. Hind and Dr. Walks. We're going to have a discussion today, and I sent all the co-hosts, including Dr. Lawson, a set of slides for discussion. And one of the things that promoted this is that for the past several months, I've been given a lot of Paxlovid that this virus of the COVID is still very much out here. And then I called on one of our viral expert, and he had gotten on a plane and somebody coughed near him and he got a bad case of COVID, was very symptomatic, and he just got over it last night. So it's still there, and I want to make sure that we emphasize that this is not something that just happened last year, the year before. This is something that's present with us now. So we're going to just put up some slides and discuss them. In addition, we know that the flu in its various forms are also rampant. And also we know that the flu comes in the bacterial flu, and we know that there is also bacterial pneumonia, and we need to protect ourselves against that. So let's go with this first set of slides, Simon. And I invite my co-moderators to chime in on these discussion slides. So we know that there are current risks for COVID-19, there are current risks for flu, and current risks for pneumococcal pneumonia, especially in Black and Latino communities. We know that in COVID-19, there are higher rates of infection, and we know that both of these communities, Blacks and Latinos, have experienced higher rates of COVID-19 compared to the white population. There are a number of factors that play a part in this, such as crowded living conditions in many cases. You have multi-generational families. Like in my house, I know I've got now at least 3 generations, including my grandkids and pets and all kinds of things in here. So that makes it crowded. We know that many of our people are frontline workers. They take care of people. They're in essential industries. And we know that for some, there's limited access to health care, and this can contribute to this disparity. Next slide. Well, it can spread just by being around people who talk, because you breathe out when you talk. We know that people sing, and we know that early on, a lot of people in church choirs and people sitting on the first several rows, there were a lot of singing going on. Coughing, of course, gets it, and sneezing. Next slide. Let's back up just a moment. Dr. Neighbor-Stevens, Dr. Walks, Dr. Hines, any comments just on how it spreads and some of the things that you may have seen?
So I'll add to what you said, Dr. Maxey. A lot of times we will not expect that the situation we're going into can be one where we can be exposed. If we're going into a large crowded concert or something, we may expect that, or going into a church service, we may wear a mask, but we may not expect going into a grocery store, for example. We can be stuck in a line next to people as we're trying to check out and things like that. So it's just being aware that you may not think, well, I'm going to go into a place where there are a lot of people, but it can still be a situation where you're confronted with someone who is coughing a lot, or with other people who may be coughing.
Well, thank you.
what I just wanted to add to about spread is to remember that you can potentially be spreading up to 2 days before you had symptoms, right? So when you think about, you started feeling bad today, right? So, and then, oh, you gave yourself a COVID test. Maybe you call, maybe you let the people know where you were. If you were at church this morning, so be it, right? But where you were yesterday and the day before are also people who you want to think about too, as far as the potential for spread.
Okay, the current slide, which I really want help in going through just briefly. How do you know if you have bacterial pneumonia versus viral pneumonia, and are there differences between the two? And I found a slide that talks about some of it. Wonder if you can look at that, Dr. Neighbor and Dr. Hines.
All right. I thought you were giving me an eye test. I went and had my eyes checked last Sunday, but I finally got it figured out how to make it full screen, big enough for me to be able to see. So before we talk about the infection, let's level set and say what pneumonia is, whether it's caused by a virus or whether it's caused by a bacterium. Now, pneumonia is an infection of whatever cause, because there are also other causes like chemical causes of pneumonia. But it is an inflammation and or infection of the substance of the lung. So what is the lung made of? You can think of the lungs as an air sac with tiny little areas. You can kind of think of it like a honeycomb, sort of, where you have the discrete little sections. Each one opens up to a bigger section, and the air can come in, and there were tiny little blood vessels surrounding each of these little areas, and the oxygen in the air that you breathe in is exchanged through the membrane into that blood, and the carbon monoxide that is in that blood is drawn out, and there's an exchange, and that's the process of oxygenation, and that's the main job.
Is it like the little bubble packs the kids bust?
You can think of it that way. So anything that disrupts that exchange process of oxygen with the blood is problematic. So I wanted to level us on what the problem is. There's disruption of the oxygen exchange process. Now, two ways that can be disrupted can be if you get a virus that attacks those areas of the lung, or a bacterium that attacks those areas of the lung. Now, the damage that the organism does may vary a little bit depending on the actual pathogen, but the end result is disruption of that air-blood exchange. So this slide is talking about signs and symptoms that help you to figure out what the pathogen is, whether it is a virus or whether it's a bacterium. So, of course, we like to do cultures, but it's a little difficult to culture the lung directly. There are some direct ways, but they're not the easiest thing in the world to do. It's not something you would do in your office. So what frequently is done is the patient is asked to give a really deep cough, and some of the mucus is collected when that cough occurs. The problem with that method of collection is that it can be contaminated by the organisms that normally live in the mouth, some of which actually are pathogens. So that's not the best way, but that is until in, the last 20 years, I guess, or so. That was pretty much the only way we had. Now, if there's a real concern about what's going on down in the lungs, there can be collection through a bronchoscope if that's necessary. So detection of a respiratory virus is required for the diagnosis of viral community-acquired pneumonia. So why is this stipulated to be community-acquired pneumonia? Well, that's because there are certain pathogens that are running around in the community all the time. And susceptible people, and we'll talk a little bit, I think, later about what makes you susceptible, may come down with it. But there are other places, unfortunately, that you can get pneumonia, like in the hospital. If you are a patient in the hospital, you can catch an organism while you're in the hospital. Those tend to be more severe infections, and they're not the pathogens that you normally run into out in the street. So that's what a community-acquired pneumonia is. I discussed the difficulty of culturing. So now, and you shouldn't be surprised by this since we've gone through the whole pandemic, there are antigen tests that can be done now to help identify what the pathogen is. However, no respiratory bacterial pathogen should be detected on any assay performed. Now, what if you've got a positive test for a bacterial infection or both a viral and a bacterial infection, which I have seen, and I'm sure the other clinicians on the call have seen this plenty of times. Detection of a respiratory bacterial pathogen typically confirms bacterial community-acquired pneumonia. However, the diagnostic yield is low. Viruses may also be detected. Viruses can serve as cofactors for bacterial infection. And what we used to tell patients was if you have a viral infection that attacks your immune system and weakens your immune system and can set you up for a coexisting bacterial infection. And that's thought to be the mechanism for having both combined pathogens. Another way is if the cause of the pneumonia is, which we're not going to talk about, but I'll just mention, if you have something that's called aspiration pneumonia, that's where if for whatever reason you have decreased capacity to clear secretions, whether it be because you are unconscious or you may be conscious and you're vomiting and you may aspirate some of the vomitus, that can lead to what's called aspiration pneumonia. Or if you have a swallowing problem, let's say you've had a stroke or something, and you have problems clearing secretions, that can set you up for aspiration pneumonia. All right, going back to the slide, chest imaging. I would actually disagree with this statement, and I'd be interested to hear what the other clinicians have to say about that. This slide is saying that you have to have a positive finding on the chest image to confirm the diagnosis of pneumonia. And I won't get into all of the reasons why I disagree, but the biggest one is that in early stages of pneumonia, there is a lag between the chest x-ray sometimes and when the actual infiltrate is visible.
Yeah, I think the operating word is confirm.
Yeah. But plenty of times in pediatrics, we don't assume a negative chest x-ray means that there's not pneumonia. In the modern day now, we don't just rely on chest x-rays. We also have computer tomography, CTs, which are frequently used. Now, for the absence of dense consolidation, dense consolidation means that instead of seeing a light, airy picture, you have collections or clouds or clumps in the image.
Can I interrupt you for a minute?
Yes, sir.
I think the main lesson from this slide is you need to see your healthcare provider. You need to see your physician, because a patient can't really do this, and they don't care whether they have viral or bacterial pneumonia. They need to see somebody who can help them decide what to do. But they're not going to do the diagnosis. They need to be seen. They need to use what you always say, common sense. When you get sick, make sure somebody evaluates you. Would you agree with that?
I hope people see it that way.
Any
Well,
thoughts
I know I
about-
certainly would too. And then to further go with Dr. Maxey's point, right? Like as when you were talking about level setting in the beginning, if you're sick enough to think that you have pneumonia, then or to be wondering, then as Dr. Maxey said, you should go see your primary care provider, your doctor, right? So that then they can do a lot of this stuff, right? Because the majority of this stuff you can't do for yourself. You can't x-ray yourself. You're not going to do microbiology tests at home, those kinds of things. Some of the clues classically between viral and bacterial, classically bacterial is usually going to come with the high fever, the thick yellow-green sputum, or what you're coughing up. Viral is usually going to have a little bit of a slower onset, and it might have some other systemic symptoms, meaning you might have had that, the body aches, the cold, I had a runny nose, I had a headache, I felt tired, I had weakness before all of this stuff started to happen. But the reality is, we still come back to, if you think that you might have pneumonia, right? Rather than run around already deciding that you have walking pneumonia, go see your provider so that maybe you're right and they can say, yep, you got it this time. Or, you know what, this isn't exactly that, and you're gonna need some antibiotics for that, because viral is gonna get better with time, right? Bacterial it needs antibiotics for sure. Viral can need hospitalization, just like bacterial can need hospitalization. It doesn't have to mean that, but both of them can end up with serious consequences.
Thank you. Let's go to the next slide and we can come back to this one. Okay, so we know that communities that are disadvantaged, especially Black and Latino, they tend to have more severe illness than others, more hospitalizations and more deaths, especially from COVID, due to underlying health conditions. And being a primary care doctor now, in addition to being a nephrologist, many of our people are sick. They have everything in the book going on. They have diabetes, they have hypertension, obesity. And what I'm concerned about, many of us have a blood pressure of 150 over 100. We say that's not too bad, but it is bad. And all these things make these types of illnesses worse. Next slide. Would one of you like to talk about this slide, vaccine hesitancy? Maybe Dr. Walks?
Sure, Dr. Maxey. Vaccine hesitancy can come from mistrust in healthcare systems, and just in our society now, just mistrust, period. Folks are less willing to take advice, less willing to believe advice. And so it isn't only mistrust in healthcare systems, it's also mistrust in medical advice in general. And it seems like no matter who it comes from, we're going to have some other individual who will say, well, that's not true, or they're lying to you. And there's a lot of that we didn't have several years ago. So this mistrust is just a general mistrust in advice, in experts, in people, in doctors, in our society. So I think we have to just be aware that folks are getting information from a lot of different sources, some what we would call scientifically based and reliable, and some that we would call popular people who influence other people. So this mistrust is a real big deal. And I think one of the other things is that many folks have, there's a friend of mine that says, don't include me in your we. So I'm not going to say we all as much as I used to. So there are a lot of folks who have completely ignored or refused to acknowledge that there are folks who should not get different vaccines for different reasons. And that's a very small number in our community, but that number does exist. And so by not being accurate, we sometimes will add to the mistrust when somebody says, well, I know somebody who, or my cousin had. So being accurate and being open is very important as we navigate the existing mistrust. So this mistrust in general has posed challenges to achieving high vaccination rates in many populations, greater exposure to flu viruses in workplaces. Not everybody has a little office where they work. A lot of folks now are working in more open spaces. Cubicles are not the same as offices, and certainly just having desks in an area where folks can communicate better and work together better means that you don't have any of those kinds of barriers. So the varied kinds of workplaces, the varied kinds of experiences that we have day to day can lead to an increased risk of contracting flu, contracting COVID, contracting a lot of issues that can put us in trouble.
So as a psychiatrist, Dr. Walks, how do you approach hesitancy or gaining trust? How do we, and what should the patient look for in trying to make sure he's got the right provider that he can trust? What are some of those things that you want to see in your provider or physician?
I think trust is trust, and we act like somehow it's different because we know a lot and we have credentials and initials after our names. But trust is trust. And maybe the first way to gain trust in a relationship is by listening. If someone knows that you are willing to listen to what they think and how they feel, that, people say, well, people don't know that, people don't care what you know until they know that you care. Well, that's true in a lot of ways. And trust is a big example of that.
I'm looking at the reverse of that. I'm a patient. How do I find out, or how do I judge that provider that I can trust him more?
I understood your question, and my response was to that particular question that you just asked the second time. When you find a provider that is willing to listen to you and asking you how you feel about things and asking you what you think about things, you can begin to work better with that provider. So as a patient, when I walk in, if my provider starts off by saying, look, I know what's going on, I know what you need, here, take this, I might be less willing because they don't know what I feel about it or how I think about it. So if I listen to this person and their reason for their hesitancy, then I can better approach how to share with them what I know.
Thank you. Let's go to the next slide, Simon. Okay. Dr. Hines, would you take this one?
Sure. So vaccination disparities. And disparities are quite the hot topic in everything around healthcare right now. And Black and Latino populations have historically lower flu vaccination rates compared to other populations. And obviously, lower vaccination rates are going to make you more susceptible to getting flu and the related complications. While this is talking specifically about flu, I will also say that since COVID, I have absolutely seen an increase in discussion around generalized vaccination hesitancy, whether it is the shingles vaccination, the flu vaccination, COVID vaccination, pneumonia vaccinations. I've definitely heard a lot more people just, well, I don't need that. I don't need that either. So I'll just say that there is a vaccination disparities are exist outside of just the flu, and have many of the reasons that Dr. Walks was talking about before as part of their, the reasoning behind that. Limited access to healthcare is just one of the reasons for disparities, because, if you don't have, everybody doesn't have a CVS or Walgreens nearby, believe it or not. And some of them don't stay stocked. They have long appointment, times and waits and things like that, that's actually a barrier to care. I mean, yes, they exist, but if it doesn't run efficiently or they don't have the things that you need, you're not going to keep trying that. And then socioeconomic factors also contribute to those disparities as well. For example, lack of health insurance is absolutely a barrier, because some of the vaccinations can be quite expensive if you have to pay for them out of pocket. In fact, it's not even realistic to think that for some of them you're going to pay for them out of pocket. Additionally, not knowing some of your other underlying health conditions that might make you a candidate for additional vaccinations also is going to lead to delays in you getting the vaccinations that you need, or understanding what you are susceptible for or to. Workplace exposures is actually pretty important, right? Because as we think about just at a very simple level, remote workers, hybrid workers, in-person workers. So you're talking about, just on that alone, you're talking about very different risks as it relates to your potential to get, or to either get or spread various types of communicable diseases. So understanding an individual's work environment is going to be very important to understanding what type of vaccinations they might need. And then, obviously anybody who is not just an essential worker, but if you are doing a lot of personal interactions with people, if there's a lot of human exchange going on in your space or in your adjacent space, and sometimes it's not even that everybody was there at the same time, even if you're working different shifts and different people are coming through and passing through, that's still an opportunity to contract things. So, and again, Black and Latino populations are oftentimes working in some of these jobs that have more human contact.
Let me raise a concern I had. I live in a middle-class neighborhood, and they've closed 2 CVS's and several Walgreens, and they're all consolidated in one store. So I went to get some medication, and there's a line at least 30 or 40 people long. And I got through the line, and they said, well, come over to this window and we'll get your medication. Went there and said, go back to the end of the line. I just went home.
Yep. And Dr. Gibson put in the chat about how pharmacies are shutting down. Absolutely. And you just made that very valid point, right? So I know that I have a friend, there's a pharmacy, the pharmacy closest to him is in the city, but they never have the medication. Like they'll send you the email that says it's ready, but then when you get there, there's nothing there. Luckily he can drive, so he can go to another pharmacy. But again, if those are the circumstances, of course, I'm going to get tired of wasting my time. Of course, I'm going to not have good outcome. How can I be compliant with my medicines if I can't even get them, reliably and in a reasonable fashion?
So when I got faced with the medicine was something I absolutely needed, I started to call Dr. Walks and say, Dr. Walks, I'm getting ready to throw this medicine at the people. I need help. So frustration, we got to make sure that we don't bite our nose off to spite our face.
Well, let me just chime in, Dr. Maxey. I know that the people who go to work at the pharmacies are working hard and they are trying. I remember getting to the window once to pick up some medication, and they said, oh, we're running 2 days behind. I said, wait a minute, you mean if my doctor calls in a prescription today, I can't pick it up for 2 days? They said that's exactly right. We're running 2 days behind on filling prescriptions. And I know they're not sitting back there watching TV for 2 days. Pharmacies are doing a lot more now than they used to do. They have minute clinics and they're giving vaccines and they're trying to fill prescriptions. And then sometimes they don't have the supply they thought they would have. Things that are supposed to be delivered on Tuesday aren't coming in until Wednesday or Thursday. So there's a lot going on at the pharmacy. And I just wanted to say that yes, I was extremely frustrated with this. We're 2 days behind. At the same time, I try to understand that when people go to work at a pharmacy, they're not intending to go to work and trying to waste my time and trying to make me angry. They may do that, but that's not why they go to work in the morning. So we have to have a little bit of patience and understand that it's very challenging to do anything that faces people, customer service, trying to provide something to someone. So I just wanted to give a shout out to my dear pharmacy workers who are tired.
Well, I just want to point out that necessity is the mother of invention, and Walmart and Amazon were already working on this, and they have now launched their mail, and several of the pharmacies have mail order services. So this won't cover you when you're talking about an emergency prescription, but certainly when you're talking about chronic condition medications that are regularly refilled, you might want to think about having your prescriptions delivered and 90-day supplies to decrease the chances of you having breaks in your supply.
So that point you just made, Dr. Neighbor Stephen, 90-day supply. I have all sort of patients who will call me on Friday night at 6 o'clock saying, I ran out of medicine yesterday. Can you do something for me now? And it's very important you keep your blood pressure controlled and other things and ask for a 90-day supply and don't wait until the last minute to get your prescription at 6 o'clock on Friday night because it may not happen. So that's a real good thing about.
While I agree with that, though, sometimes it's not the person's choice. Plenty of times, because sometimes providers refuse to do 90-day supplies because they want to make sure that you come in, right? Or the other is just because you have a 90-day supply doesn't mean the pharmacy gives you all 90 days when you go. Sometimes they'll only give you 30 days at the time, and then you can still end up in the same position. I would also say, especially in the context of Dr. Neighbor Stevens, your comment about Amazon and Walmart getting into the pharmacy game, it's interesting because in the context of hesitancy, there are a lot of people who are concerned with having their health personal information out there with those entities. It's very different than your address, even your credit card. That is a big issue for a lot of people to especially in the context of all this data security stuff. And that's a barrier that they're going to have to work hard to overcome. Amazon in particular.
Well, that's good. Thank you so much. Dr. Neighbor, you want to take the next slide?
Where it's talking about some of the underlying health conditions that can set you up for pneumonia. If you have any of our regular players, the chronic conditions, number one being asthma and COPD, and then diabetes and cardiovascular disease, heart disease. These can make you more susceptible. Environmental factors, such as being exposed to environmental pollutants, being in overcrowded housing and potentially work conditions. I'm thinking about some of the agricultural factories, the chicken factories and stuff, and limited access to quality health care can contribute to a higher incidence of pneumonia. And barriers to care, limited access to preventive healthcare services, and delays in seeking medical attention for respiratory symptoms can also result in more severe pneumonia outcomes.
One thing that I've seen is a lot of black mold and many of our residences have black mold. Have you seen a lot of that? Anybody?
As far as black mold being the source of the respiratory problem,
Yes.
I've seen a lot of people who were concerned about that and who have posited that as their issue. I've seen very few people who actually documentedly had that as their actual source of infection.
Okay. Let's go to the next slide. Would one of you take this one? Dr.
All right,
Hines?
I'll take this one. Current recommendations for prevention and treatment of COVID-19. So the one with the 2 stars next to it, Dr. Maxey, is the one that reads increase access to COVID-19 vaccines through targeted outreach programs, mobile vaccination clinics, and community partnerships. A lot of folks, I will hear this phrase, when we used to have COVID, when we used to have COVID. And people are making this assumption that just because time has passed, that COVID is something we used to have. Well, we used to have COVID restrictions. That's what we used to have. We don't have COVID restrictions. We don't have vaccine requirements, but we do have COVID continuing to be in the community. And I'm saying that because sometimes you do have to state the obvious, because people want to ignore what they want to ignore. I would love to ignore that COVID continues to be a problem. However, it continues to be a problem. So we have to address vaccine hesitancy through culturally sensitive education and engagement efforts. We talked earlier about the importance of listening to people who have hesitancy and not just tell them that they're stupid. Oh, you're stupid. You're not going to get through to someone by dismissing whatever it is they're concerned about. Treatment, Dr. Maxey mentioned early on about the amount of Paxlovid that he has been prescribing to folks. It's important to make sure you talk to a healthcare provider about if you're an appropriate candidate for Paxlovid. Ensuring access to COVID-19 testing. The government was mailing out COVID-19 tests just at your request through the post office. You could get COVID tests sent to your home. Many jurisdictions are still providing COVID testing in the community, and it's important to find out if you can get free COVID tests either at your pharmacy or through your local or regional Department of Health. So ensuring that there's equitable access to testing and healthcare services and treatments, all of that, all of those are things that we as providers and we as patients need to ask about. Promoting early recognition of COVID-19 symptoms and monitoring for severe illness, and then timely medical intervention. What I'll say about these last couple of bullets is this: just because you recognize that, oh yeah, I didn't feel good, I took a test and it's COVID and I'm feeling okay, doesn't mean that you will not progress to having a more severe illness. And so monitoring how you're doing, monitoring how you're feeling, checking if you have a fever, all of those things are important. So you don't just say, oh, it's just COVID. My neighbor had COVID and they're just fine, so I'm not going to worry about it. So that's
Dr.
what I've got.
I've got a curveball question for you. How do you explain or at least address the fact that it seems like some in our majority community don't care that underserved communities are more at risk, and therefore they say they don't need to do all these things? For the same reason, a certain group of some of those communities don't believe they have to vaccinate their kids for measles or other things, and they want to send them to schools with our kids. How would you comment on that from a mental health standpoint or political standpoint, whatever you want to say?
Well, Dr. Maxey, I think you answered part of the question with the last bit of it, which is sometimes there are political reasons, sometimes there are personal reasons, sometimes it's all of the mistrust that we talked about earlier. I think it's important, again, for us to listen to where someone is coming from. as they approach that, whether it's an individual or it's a community, or it could be some sort of a group of which they're a member. And so we have to listen to what the challenges are and then address them challenge by challenge. What people ultimately feel and what they ultimately decide to do is what people feel and what people do. So we have to make sure that we are aware that these challenges exist. And if it's a community thing, if like the whole Board of Education votes for something that we don't like, we have to vote the next time the Board of Education term is up, and we can put somebody else on there. So we have to take
Protect ourselves, self-defense.
I'm sorry, Dr. Maxey. I was talking, and as my mama says, you can't learn anything while you're talking. So I didn't hear what you said.
I'm sorry, I thought you put a period. I thought you had stopped. I'm sorry. Go ahead.
No, that's okay. Look, stopping me from talking is really an important thing to do, because I can't stop on my own.
While we're in this little hiatus here between the talkers and the listening and the skill that it requires, Dr. Gibson would like to give us a test on our listening skills and has a comment or a question.
Dr. Gibson, join us, please. Can you unmute Dr. Gibson?
There you
Thank
go.
you very much to the whole panel. Actually, there's several things that I feel strongly compelled to address, starting with Dr. B, also all of you, really. It's important that people get informed. Yes, it's true. They don't care how much you know until they know that you do care. That's critical. That's job number one. People have to feel like you really, really do care. Eye contact is crucial. Let me say that again. Eye contact is crucial. If people really believe that you're paying attention to them and you're really listening to them, they're a lot more likely to believe what you say is sincere, whether it's true or not. They're more likely to believe at least you really do care. Now, there are other things, there are serious problems that we have with the fact that our so-called healthcare system is broken. It is not an efficient model whatsoever, and it suffers from the, how can I say, symptoms of avarice on the part of certain players in those equations, and that's something that it's really bigger than anybody on this particular session. But I will say this: there's a responsibility that we have to let folks know that guess what? COVID is just like a common cold. It has joined the ranks of those seasonal infections and maybe not so seasonal infections that's here to stay. It hasn't gone away. You may not hear as much about restrictions as you used to, but it's here to stay. And when you feel those symptoms, you need to get immediate attention because the medication, such as it is, the Paxlovid and such, is only going to be as effective as it is used properly, which means right away. Right away, do not hesitate. Get the prescription and take it as directed. So I say all that to say that Houston, we got serious problems here because there's a whole lot of information that there's always something new. Let me say that. And when we were at the onset of the call, Dr. Maxey said that we have a influenza virus and that we have a bacterial influenza. Now, my impression is that influenza is viral. And I wanted to ask, I'm asking now, Dr. Maxey, is influenza viral?
It is viral.
Okay. All right. Well, and there are bacterial
But
complications.
we do know that the three problems I want to bring up was COVID, flu, which is viral, as well as bacterial pneumonia. And people should be getting bacterial pneumonia vaccinations as well.
Absolutely. Thank you. That you stole my thunder.
Thank you so much.
I'm done. Sorry.
All right, thank you. Let's go to our next slide. I think we're coming to the close here. Okay, I think this is just a repeat of some of the other ones, but one of the main things I see on this slide for prevention is smoking prevention, which is a real problem, both smoking and vaping. And we know that we've talked all the time about regular exercise and get timely diagnosis. Let's skip this slide, go to the next one. So we know that we need to address our health care in general. We need to do self-protection, self-defense. We need to know that we need to have cultural competence and cultural sensitivity when we take care of our people. We know that there are barriers to health care that we need to try to obviate. And we know that those of us who are involved in healthcare need to collaborate. And we need to have healthcare providers collaborate and not have silos between physician and providers' offices that we don't pass information. We know that we need to educate community organizations to help us. We need to help our policymakers understand that they have a role, and we need to implement targeted interventions that promote health and equity in our communities, especially. Let's see if there are any questions, any more discussion any of our co-moderators want to make. Simon, you can end the slides. Dr. Neighbor Stevens, Dr. Hines, Dr. Walks. Any of our people.
Let me add something, Dr. Maxey. One of the slides that you just showed mentioned exercise, and it's really important for us to exercise for any number of reasons. One of them is our lungs like to be fully inflated. The lungs enjoy it when you get that diaphragm low and take deep breaths, which many people will do during aerobic exercise. When you're out there and you're breathing, it helps your lungs to function better. It helps with anything that's trying to set up shop in there, bacterial, viral, whatever it is. If you have a healthy set of lungs and you're approaching, which is one of the reasons why smoking is a problem, why asthma is a problem, COPD, chronic obstructive pulmonary disease is COPD. All of those are challenges because they don't allow your lungs to work the way the lungs want to work. So, when it's not 105 degrees in Maryland, it's nice to get outside and take a walk, a brisk walk, and let your lungs do what they like to do.
Excellent. Dr. Neighbor Stevens.
I want to underscore the importance of knowing the reliability of the source of your information.
Huh.
Yesterday, I've been out and about all day today, so I really don't know what's going on in the world today. But yesterday, there was considerable conversation around misinformation that's being disseminated by certain influencers on social media regarding the need for preventing sunburn by putting on sunscreen. And this has been going on for a minute. And now the dermatologists are reporting increasing numbers of skin cancer diagnoses on increasingly younger people because the information was bought lock, stock, and barrel, and people are being exposed unnecessarily to the different UV, and there's another one, UV and another type of
UVA and UVB.
Thank you. Rays of the sun that are detrimental to skin health. And to me, it's the same phenomenon that we went through with COVID. It's what we are going through. Years ago, we went through on measles on a smaller scale, but now it's a much bigger scale. At the end of the day, you need to verify the sources of your information and the veracity of the information that's being disseminated before you buy into it. And I don't know what the remedy is to that, except that people need to stop letting other people think for them and start thinking for themselves.
So Dr. Neighbor Stevens, are you trying to convince me that just because someone is very attractive and has a lot of money and speaks really well, I shouldn't believe everything they say?
I'm thinking about something that my mother used to tell me when I was a little girl. When there'd be something on TV and I wanted to watch it or do it or whatever. And my mother would say, those people have already made their money. You have yet to make yours.
Hmm.
And I think it's
Absolutely.
applicable today, just like it was back in that day.
Well, good. Well, we're almost at the top of the day, the hour. So I want to have our final comments. Next week, we have Dr. Sherry Moloch, who's going to speak about mental health issues and suicide. She's a referral from Dr. Lawson, so I'm sure she'll be great. Let's start with Dr. Hines for final comments and then go to Dr. Walks and Dr. Barbara Neighbor-Stevens. Dr. Hines, our youngster.
I just wanted to, we focused a lot on COVID and flu and pneumonia, but there are other recommended vaccinations or potentially recommended vaccinations for both adults and children that you need your primary care doctor to discuss with you. So there's recommendations based on age, there's recommendation based on life events, or if your job or travel or health conditions. In particular, since our discussion was about pneumonia, about 3 or 4 years ago, if you were over 65 and you got the pneumonia vaccination before 4 or 5 years ago, you need to be sure that you are up to date on the current recommendations regarding pneumonia vaccinations because it changed. So about 5 or so years ago, the vaccination they were using for pneumonia isn't what they use now because the one that they were using previously wasn't even targeting the bacterial pneumonia that is most common for adults, right? So they've changed those recommendations. So I say all that to say, we had a targeted discussion, but the underlying issue is, as we always come back to, you need to talk to your primary care doctor about what's going on with you. What do you need as an individual? And then also, I just have to chime in on Dr. Neighbor-Stevens' point about, because I saw that, I heard the same story yesterday about the sunscreen and things like that. Remember, some of these people who you see on social media, they are there for your clicks. Right? They may not even believe in, do, or actually espouse to whatever it is that they are promoting, right? So all they wanted was for you to watch their videos. So sometimes what you think looks real and that's how they're living their life, it's clips, it's edited, it's not. So just because it looks shiny, right? That's what marketing is. That's what commercials are for. It's just a different form of commercial. So getting verified information from trusted experts is important.
Thank you, Dr. Hines. Dr. Walks.
Wow. So I mentioned earlier about looking at what's happening in our community, and the next time the school board is up for election, understanding who's running and voting. We are in a very interesting time in our country, and it relates directly to our healthcare access, our healthcare resources. I've heard people say something that really disturbs me and says, well, I don't like the candidates, and so I'm just not going to vote. And I said, well, if you don't vote, you're actually voting because you're voting for whoever the other person is voting for that you really don't agree with. Well, I don't like A and I don't like B, but I really hate B, but I don't like A. So I just would encourage all of us to think longer term about the access we want, think longer term about the needs of our community, think longer term about the access we have to certain things that we think are just plain ordinary, but may not be ordinary a year from now or 2 years from now if we don't get our own information, as Dr. Hines and Dr. Neighbor-Stevens have emphasized, and really participate. Not voting as a way of protesting it just doesn't make any sense. Even if I don't like A or B, if I really don't like B, I better go out there and vote for A and then try to fix it the next time around. That's what I got.
I have two questions. I don't like T, but I'm gonna like B. But what was the subject of your sermon today, Dr. Walks?
I'm sorry. What did you say, Dr. Maxey? Sometimes you just discombobulate me. What were you asking me?
What was the subject of your sermon this morning?
You know what, Dr. Maxey, that was not the subject. The subject of the sermon at church this morning was not about elections. I just know that I've just heard so many people telling me I'm not going to vote because I don't like either of my choices. And I think you have to vote sometimes for the choice that you dislike the least.
You know, I was actually asking what was the actual sermon this morning at your church?
I don't remember what the actual sermon was. You got me all this. Jocelyn, what was the sermon at church this morning?
He was talking about you have to fight and finding your motivation. We were targeting towards entrepreneurship, right? And finding people in your life who are going to push you forward, who are like the catalyst for ideas, who are going to be your intercessors. Let's see, things of that nature, right?
Yeah, Dr. Walks, what row were you sitting on?
Dr. Maxey, I got to church late this morning. I was sitting in the overflow section because it's first Sunday, and all of us Christians that can't get there on the other Sundays, we get there on first Sunday, fill up the parking lot. I had to park down the street. They fill up the sanctuary. I had to sit in the overflow. It was a tough Sunday for me.
Okay, all right. Dr. Neighbor-Stevens.
So I was kind of on the same wavelength as Dr. Walks. And I'll just say, first of all, this is my opinion. This is not the opinion of Black Health Trust, just to be politically correct there. But I want people to stop thinking of it in terms of this choice and think of it more in terms of these issues. And I would submit that this election is second only in importance to the election when Abraham Lincoln was elected. I believe from a historical perspective, the critical changes and impact that resulted from his election are similar to the impact of the result that will come from these elections. So I hope, and I don't think people do real well with abstract. I think we need concrete thinking. So I want you all to think about it from that point of view.
Thank you, Dr. Stevens. I find myself in agreement with all of the co-moderators. But I will say this. I think that it's so important to have a right-thinking administration. And remember, an administration is not just one person who calls himself the president. It's the whole thought process, the people around them and the things they do. And I think we need to consider keeping what we have. And the people that are most likely to support the things that are important to our communities are in place. We thank you, Simon, for help today, and we'll look for everybody next week. Have a great Sunday. Have a great day.
Bye.
Good day, everyone.